Hi everyone. In the second lecture, I will focus on what the barefoot doctors actually did, what kind of healthcare they provided, how the Chinese government presented the barefoot doctors in terms of propaganda, and then we will assess finally what kind of institution it is. If we take away cultural revolution, if we take away the propaganda aspects of it, what actually it was. And from that aspect, we will study whether that is a model that can be used elsewhere. So, the question for this lecture is that whether the barefoot doctors is a typical product of cultural revolution, which makes sense within China, within that cultural revolution, within that inward looking phase that China went through in that period, or is it a much wider institution with a very Chinese structure to it, but is it a much wider institution that can be talked about within a wider areas of other kinds of rural healthcare areas? So the first topic that I will refer to is the question of propaganda, because as you remember, as a part of the Cultural Revolution and Mao's ideas of rural healthcare, the Red Army, this is the kind of the barefoot doctors were kind of the Red Army of the doctors. So they were the kind of they recruited a band of army going into the villages. So this became the barefoot doctors became the face of this new modern China and how China did healthcare systems. So propaganda of the barefoot doctors was a very important part because China wanted to highlight not just to the world, but even to itself, its own citizens, that this is a new China. It's cut away from the feudal colonial past. It is going through a cultural revolution, and barefoot doctors as a critical part of that cultural revolution. So there was a key part of propaganda about the barefoot doctors that was important. So what is important for us to remember that it is difficult to imagine the barefoot doctors without the state propaganda that existed. So the barefoot doctors presented a suitably revolutionary image, the cultural revolutionary image that's new for old. The young people who waded undaunted through the mud of rice and paddies to provide medical service in the answer to Mao's call. In medical health, put stress rural areas. So this was they were carrying um, Mao's vision into rural healthcare, in the walking through the paddy fields, talking to ordinary people, serving them. So it was that idea that image was quite important. They became symbols of the Chinese cultural revolution as heroic, gallant medical men and women, combining traditional Chinese values with modern scientific methods. That combination of old and new, which is very important in cultural revolution, traveling through the remote countryside, delivering health and medicine to the poor peasants. So that propaganda was quite useful. And it presented this idealized image of village healers, these modern village healers who are coming. You'll see a lot of propaganda kind of images. I'll show you some in the next slide, but you'll see those images that these doctors are going into the remote areas, serving the people. The people are coming to them with smiles. So that is a very important part of what the barefoot doctors were presented as. And this is two examples. There are two films. These are kind of more propaganda films that were made. Something that you have noticed within Soviet Union and also NHS, that in that period when these institutions were being built, that is whether the NHS or the Soviet healthcare system, there were a lot of films made. So NHS films, which you have seen, even the Soviet Union films were made as propaganda about this new institution. And China was no exception. So China made its own films about its own healthcare systems, within which the barefoot doctors were a key part of the Chinese healthcare system and the Chinese films that were made. So when you see these films, if you want to see these films, you kind of remember that there was a larger genre of such health promotion films or promotion for health films that were made in that period. And this is a China. Again, it's a useful way to think that it is very Chinese propaganda. But is this propaganda about health very uniquely Chinese, or there are other instances of it, as we have just mentioned? So this is, and this article, if you want to read this article, it's very useful. The Edge of Expertise Representing Barefoot Doctors in Cultural Revolution in China. And this article shows that how it's a short article. I would recommend, if you want to read, just go ahead and you can click the link and read it. And it shows that how the barefoot doctors were represented within the popular media and films. And this one is the front cover of the People's Good Doctor, and look at the face, the smiling, the looking upward, upright, looking to the horizon, that kind of image. Although Lee was neither an official barefoot doctor nor a Communist Party member, she would come to represent the ideal rural practitioner in the inaugural issue of the Barefoot Doctor magazine. This is the Barefoot Doctor magazine, and she would be represented as the ideal barefoot doctors. The other film is Red Rain, and Hong Woo, in the film Red Rain, it told the story of a teenage barefoot doctor named Hong Woo, which means Red Rain, who defeats a corrupt local physician, Sun Tianfu, to take medicine to the rural poor. It's the old feudal structure. The local physician was corrupt, and Hong Woo comes as a new doctor, new change, new vision, new ideas, and new ways of doing things. So in a way, there's a duality that I'm trying to present. In a way, this is very much cultural revolution. In a way, this is very much new for the place of old. That image of cultural revolution, new China in the place of old China, new corrupt China, old corrupt China, old feudal doctor rural in the rural areas, new barefoot doctors, and that new image. But if you step back from it and also see it slightly in a wider angle, you see that even in an NHS film, you see this old against new. Even in Russian films, you will see the old against new. So what is important is that social medicine, whether it's China, Russia, Britain, or even Canada, if you see the propaganda films even of Canada, you'll see this, that social medicine was built on this idea of the new against the old, the corrupt new old practices. And remember Segarist's statement that 2000 years of medicine was that, and social medicine was a new one. So that old and new model that is very much in the barefoot doctors, in the propaganda of the barefoot doctors, is not necessarily unique to the barefoot doctors. That is the point I'm trying to say, that this duality is very important in the propaganda medium. So if apart from the propaganda, let's take a quick look at what did they actually do, apart from this major propaganda model that they were presented within. So the barefoot doctors replaced old village healers. This was the intervention of the modern state medicine in rural areas. So this is what exactly they did in terms of change in the healthcare systems. The barefoot doctors were required to study both therapeutics and prophylaxis, were both Western and Chinese medicine. As I said, there was a much more hybrid practice. Women barefoot doctors, in addition, learned midwifery, maternal and child health care, and the use of contraceptives, induction of miscarriage, and other methods of family planning. This process was also influenced by the proliferation of Western medical pharmaceuticals. As I say, that it was not just traditional Chinese medicine that they use. In practical terms, they use a lot of Western drugs, which allowed the barefoot doctors to develop a medical knowledge structure influenced by Western ideas. So they were almost trained in a Western medicine because they prescribed much more Western medicine than traditional Chinese medicine. It also led to a proliferation of the use of antibiotics because, in many kinds of infections in rural areas, antibiotics would be the most useful way to provide medicine and relief. So that is why, rather than traditional Chinese medicine, antibiotics were much more commonly used. According to a study, so this is despite the propaganda, right? The propaganda this is a Chinese institution, but this is actually very much a Western medical institution based on Western medicine. According to a study, 37% of cases of common cold and 57 cases of gastroenteritis were treated with antibiotics. Despite the stated preventive emphasis on the barefoot doctor program, almost all the direct service time was spent providing basic curative care. So it was not really preventative. They were not doing preventative work, which was kind of the hallmark of social medicine that we provide. They're basically doing curative, cuts, injuries, and other birth-related problems and other kind of healthcare system problems. So they were attending medical emergencies or problems and trying to address those rather than providing preventive healthcare. Vaccines for the most serious diseases they provided. Measles and epidemic cerebrospinal meningitis were produced and applied in rural China by 1970. So as the vaccination programs were expanding, that's when the barefoot doctors schemes was also expanding. As the mortality rates of measles and epidemic cerebrospinal meningitis were the highest of all the infectious diseases affecting rural China, the production and application of vaccines for them were of great significance. So again, this is Western medicine, right? Vaccines and not traditional Chinese medicine. The mortality rates of infectious diseases started declining after 1968 and dropped to their lowest ever levels by 1970, where they have remained ever since. So the intervention of Western medicine, the intervention of the barefoot doctors, and the intervention of vaccines, which took place in that period, 60s, late 60s to 70s, had addressed the problem of mortality decline in China in a massive way, which has remained as such. So it had established a stability of a system of medical care in rural China. So healthcare standards have risen steadily in China thanks to part of the work of the village doctors and health workers. Again, if you want to read about these, this is the article that I'm using this information from. In 1964, the rural people accounted for 80% of the whole population, but only 31% of high-level health professionals and 43% of middle-level health professionals worked in rural areas, with only 27% of total health service funding allocated to rural areas, only 27%, although 80% of the population lived in rural areas in 1964, that is before the Cultural Revolution. At the end of the 1975, almost a decade after the scheme was started, the barefoot doctors, there were 1,500,000 barefoot doctors and 3,900,000 health workers, including midwives, across the country. So in that period, it had expanded exponentially. And it is not an exaggeration to say that it's barefoot doctors, the institution of barefoot doctors and rural healthcare services that came with it, revolutionized Chinese rural healthcare system. One of the reasons why Chinese mortality rates declined and have remained ever since there in rural areas, one of the reasons why China achieved much better rural healthcare system compared to countries like India or several other countries in Africa is because of the barefoot doctor program. Again, if you want to read about that, actually maternal and childcare healthcare system and the role of the barefoot doctors in that, please feel free to read this article. So finally, we come to the question: is it a product? So is the barefoot doctors a product of cultural revolution or of social medicine? The reason I am posing this question to you is because we are presenting very different cases in front of you, like Soviet Union, Britain, China cultural revolution, and these are all unique in themselves. But what is interesting is they're all taking place not Soviet Union, but cultural revolution in China and NHS in almost roughly the same period, the 60s, 70s. That's the expansion is taking place. So the question is, are these very unique institutions or there are commonalities between these institutions? Why was there in the post-Second World War period such emphasis on healthcare services to be reached out to a much larger population, a wider population? So this is in that respect is the scheme of barefoot doctors, which is part of Chinese healthcare system, a product of that larger movement towards health for all, which is the subject we are studying. And I would like to think, it's an open question for you. You can discuss it in whichever way you want to, and it's absolutely fine. But I like to think that it is a cultural revolution product, a product of cultural revolution, but it's also a product of the social medicine movement of the middle of the 20th century. So the barefoot doctors were a new and revolutionary model of healthcare delivery, beyond the existing ones of establishing hospitals, asylums, and dispensaries. The main impact of this new program was the introduction of modern Western medicine into villages that were hitherto served by traditional Chinese medicine. Although a uniquely Chinese institution and a product of the Cultural Revolution, barefoot doctors serve the same purpose of social medicine. It is my opinion. I'm not hopefully forcing that on you, but that's my position in this. And I would encourage you to take your own positions on this. Providing affordable primary healthcare service, PHC, to a large section of the population. As you know, the Alma Mater Declaration of 1978 made PHC as a key part, and China had almost demonstrated how that can be done, the PHC model, the primary healthcare model, through the barefoot doctors. It also merged ideas of socialism and healthcare. So same principles on which the NHS was born, not fully carried out, but NHS was born out of an idea of socialism and healthcare. How Soviet Union healthcare was born out of socialism and healthcare. The same model was used in China. Again, that is a general model than a specifically Chinese model. Through them, the villagers first came in contact with state-sponsored public health. All of these are kind of social medicine, the reaching out of medicine to our much larger section population, and barefoot doctors schemes enable that. To that extent, they were similar to the midwives, nurses, doctors, and other workers who served rural areas of Cuba, Soviet Union, and even Britain. So my position here is that it looks in a way different, but it is serving almost the same purpose of social medicine in other parts of the world in the same period. So it is, in a way, to me, a product of the a social medicine, although it is a product of the cultural medicine, cultural revolution. So finally, the WHO regarded China's Barefoot Doctor Scheme as a successful example of solving shortages of medical service in developing countries. So it does not, according to the WHO, this is not just a Chinese institution. It has wider implications. So the Barefoot Doctor, in fact, became the model for the Alma Ata Declaration of 1978 for health for all, which I've talked about. And that is the declaration, and you will see how the WHO talks about it. This was the mode through which China expanded its own principles and base of social medicine and its social base of public health. This was the Chinese version of social medicine. That's my uh, argument about on this question, or my answer to this question. I just wanted to spend a couple of more minutes about what is the future. So because one of the points about this course is that we are studying the past, but we are standing at the crossroads of where the future of healthcare system lies, and that's something we're going to discuss. And increasingly in the next few weeks, we will talk about the future. And one of the main problems are that how do you provide healthcare for a much larger population in circumstances where it is difficult to reach out or establish hospitals or healthcare systems, and it's called expensive. So what is the mode through which to be done? And does the barefoot doctor, or the model of the barefoot doctor, doesn't have to be literally barefoot, as you know, but does the model have a future? So in the 1980s, with the market reform, the barefoot doctor scheme came to an end. But the program served as a model and inspiration for the famous 1978 Alma-Ata Declaration on primary healthcare. Is there a future for the barefoot doctor in the 21st century when rural healthcare remains a problem? Can we have someone with 2 to 3 years of training in high school will be enabled with new technology, apps, and web-based tools to help widen the reach of social medicine? So we need to think in different ways because we use more remote technology, particularly in this pandemic that has become evident, apps. So can we have not doctors, but somebody with some degree of training, providing that important information of basic medical care, of basic medical knowledge against rumors, against doubts, against misinformation. So can the barefoot doctors be reinvented in the 21st century in that role of using technology in a different way and basic medicine, but new technologies in reaching out to a much wider population? In the fifth wave, which we have introduced earlier and which we'll study in a couple of weeks' time, as we stress on decentralized healthcare systems, that we can't have healthcare systems based on just hospitals, big hospitals, or one institution, the NHS or the state. We need to decentralize and let people take up their responsibilities in healthcare systems. Can use the model as a new form of social medicine, not based on large hospitals, clinics, doctors, and nurses, but on intermediary groups with relatively lower costs and wider reach. So think about these questions. As I said, one of the main points about this question is to think about what the future lies, about what is our healthcare system. And I'm trying to um, give you information through which you can have these debates. If people ask us, what is the future of healthcare system? You can then come up with the example of the barefoot doctors. We don't have to go back to a similar model, but can we introduce something that is useful using that principle of people with minimum training, but with clear messages and reaching out to a much larger population. And you'll see in next week when we study Cuba has devised, and which is still continuing, its own form of community healthcare system. So these are the models I'm providing you with to have a debate about the future of healthcare system, because I think, as I started this course with the point, that it is our choice to make. It is not an inevitability that how the healthcare system should look like in future, the neoliberal healthcare system. It is our choice to make about what kind of healthcare systems we achieve. As the choice was made in the 1950s and 60s, the choice is still to be made. So this is the debate about the seminars that I would be asking you to have. One person is saying Barefoot Doctors is a typical institution of cultural revolution of China, and the other person is saying Barefoot Doctors is a Chinese example of social medicine. I'd be interested to know where you stand on this. Okay, thank you.